Welcome back over here at the Daily Dope, where we're talking about studies. I have a lot of studies this week. I was looking around at the things that I'm going to be putting together for a weekly show, and I noticed that there's been a lot of studies that just came out in the last week, or at least I've seen a lot of articles about studies. And of course, like I always say, the studies will set us free. These are studies done about cannabis or medical marijuana. Oftentimes they do these studies to try to prove, some negative shit about weed, or just kind of look at some of the claims that people have made or other studies made for that matter. And in this one, we have further proof and further evidence that cannabis, access to medical marijuana, will reduce opioid deaths, period. There's no other fucking way to look at this data. This is an article at the freshtoast.com. Kind of funny, I never even heard of these guys, and all of a sudden 10 articles just pop up about weed all of a sudden. So I don't know, maybe the weed news is catching on and other people are checking into it. You wouldn't know by looking at my channel. We got an audience and some clips take off or whatever, but for the most part, I don't think people really care too much, to be honest, about this kind of shit. But one of these days, when someone does care, this video will be there for someone to look at. And this video is all about this study, Proof Cannabis Can Help the Nation's Opiate Problem. And it's written by Terry Hacienda. Medical marijuana dispensaries save lives. That's the conclusion from a Rand report funded by the federal government. Now, the other day I did a story and there was something else that was going on where the Rand report did some kind of study or something to that effect. And in that story, I think I mentioned that the Rand Corporation is like a right-wing think tank. I kind of looked into it more, and it looks like they're kind of middle of the road. I wouldn't call them right-wing. They're really old. They've been around since the World War II era, or after post-World War II, they were hired by the military to kind of figure out, a strategy of how to move forward with the military-industrial complex, I guess. So anyway, they did this study. The study published earlier this week in the Journal of Health Economics demonstrates that states with medical marijuana dispensaries experience a significant decline in opioid deaths over a 10-year period. The study concludes, in short, our findings that legally protected and operating medical marijuana dispensaries reduce opioid-related harms suggest that some individuals may be substituting towards marijuana, reducing the quantity of opioids they consume, or foregoing initiation of opiates altogether. The things that I always talk about when people like Chris Christie wants to ignore cannabis and throw medical marijuana under some kind of a bus and say that it causes more people to get addicted to opiates, whatever, we don't believe any of your talking points. And if you just keep repeating them and shit over and over, that doesn't make them true, and it doesn't make anybody believe them. It just makes you look like an idiot and a parrot. Marijuana is a far less addictive substance than opioids, and the potential for overdosing is nearly zero. Anytime anyone says nearly zero, I don't know what to think. But then again, there can be some adverse effects of cannabis if you take too much of it that some people wouldn't be, it's not very fun. Let's just say that. So I'll give them that, all right? The study was funded by the National Institute on Drug Abuse. The same agency that reported opiate deaths from rates from overdoses have quadrupled since 1999, numbering in the tens of thousands a year. We also know the National Institute on Drug Abuse is part of the National Institute on Health, which is the only people who authorize, with the DEA, that they authorize people to do studies and experiments using actual cannabis that they approve in a grow facility, and there's only one grow facility still in operation that I know of. Others have put in submitted to try to do some crops. I haven't heard about those crops yet. Anyway, in 1996, California became the first state in the nation to legalize medical marijuana. At about the same time, doctors began to drastically increase prescriptions for opioids, especially for general pain relief. Now, for context, I have this map from, Mike Lee of all people. But basically, this is called the Social Capital Project, and I don't know, I'm not going to get into what it is, but I just wanted to give it credit for making this map. Apparently, this map is the unintentional opioid overdose deaths crude rate per 100,000. And if you can see that the progression started in the early 80s, you started seeing deaths late 70s, early 80s, and then it just started getting crazy in the 90s, 2000s. It started escalating more, and yeah. And the reason I was looking for this kind of a map was to illustrate that places with medical marijuana, and a lot of these places don't record proper numbers, or there's just nobody that lives there. But where there is places that people live and there is opioids, there is deaths. Where medical marijuana has safe access, there's less. And this study is there to back that up. And here's just one more contextual visual for you. The rate of unintentional drug overdose deaths from 1968 to 2015. And you can see that per 100,000, we were over here in the 1 zone, over here in they said in the late 60s. And I mean, yeah, man, it's a lot of people dying right now. No other way to put it. This is actual numbers then. So, overdose deaths, 1968, there was 1,692. In 2015, 44,000. So, that's all, just some context. Opioid-related drug overdose killed about 116 people every day in 2016, and roughly 11 million people misused prescription opioids, the U.S. Department of Health and Human Services reported. On the other hand, not one person has died from cannabis overdose in human history, and as this week's Rand study confirms, medical marijuana laws are associated with lower opioid overdose rates. But what the Rand study also shows that the opioid problem is less severe in states that have well-regulated, easy-to-access dispensaries. Because legal protections of retail dispensaries do not mean dispensaries are operational, we construct our policy measure to identify the state and year in which dispensaries are both legally protected and open for business, the researchers wrote. Dispensaries, retail outlets that sell marijuana to qualified patients, contributed to the decline in opioid overdose death rates. Let that last sentence sink in. What the study clearly concludes is that dispensaries help decrease opioid deaths, period. So I guess the writer is trying to drive that point home, because we keep hearing Jeff Sessions and Chris Christie and other people in the administration talk about the opioid crisis. They're always talking about everything except for medical marijuana. And then when you ask them to talk about medical marijuana, they're always like, oh, no, those are, dispensaries are bad. Medical marijuana is not a way out. It's just trading your addiction for something just slightly less horrible, as Jeff Sessions called it. But they just want to ignore these studies, the data, the facts, kind of like Harry Anslinger through LaGuardia's report that took over 5 years in New York City of study of marijuana. They just want to ignore that shit. They don't want that to be out in the public sphere, and they know that if they beat home their propaganda, enough people will believe it to where they don't look crazy when they start raiding people and busting people doing legitimate business. So, I'm just saying, we can't get this information through to them. I don't know how frustrating this is. It's like, yeah, they know this. I'm pretty sure they know this shit, but they don't care. They just want to continue with their policies, and their donors are, people like the prison lobby and people like big tobacco and big alcohol, people that just want marijuana to go away. And maybe they don't really understand that their fucking reefer madness and super strict enforcement shit isn't really working. So, from the study, quote, using data from just the early period of these laws, 1999 to 2010, dispensaries reduced opioid mortality rates by about 40%, above and beyond the reduction from marijuana laws alone. The total effect is estimated to be even larger. When we consider the full time period from 1999 to 2013, the estimates imply that dispensaries reduce opioid mortality rates by about 20%, while the main effect of having the law is relatively small in magnitude, implying declines of about 5%, and not statistically distinguishable from zero. Importantly, together, a marijuana law with a legal operational dispensary provision, the estimates imply statistically significant, at least 5% level, decline in overdose death rates of about 25%. So what they just said there is that just the laws alone reduced opioid mortality rates a little bit. But when you add safe access to dispensaries in those areas, we're talking a bigger decline of up to like 25%. So you went from like 5% to 25%. Quote, it is clear that operational dispensaries are critical. The evidence is consistent with the need for a clear and legal supply chain for medical marijuana policy to have an effect. This study supports earlier research that demonstrates how cannabis can help those suffering from opioid abuse. A 2017 survey of patients suffering from pain who use both opioids and cannabis revealed that participants reported more satisfaction with cannabis. In that study conducted by Amanda Ryman, a medical marijuana researcher, patient reported these reasons why they switched to cannabis over opioids for treatment of pain. Less chance of experience withdrawals, fewer negative side effects. Cannabis was simply more effective for the pain. And I say that too. I'm a chronic pain suffering person with debilitating spinal injuries to my neck. And quite frankly, opioids or even just regular NSAIDs, they work until they don't work. And then it's just a matter of managing the addiction. Like, you just got to take them just to operate, just to be able to wake up and not puke on yourself and, fall right back asleep and feel like a wreck. Come on. Jeff Sessions said that people with debilitating pain should take 2 Bufferin and go to bed. These people they're stuck in their bed, and it's not like, the opioids are helping them get out of bed. So whatever, man. And I think this right here is that study. 81% of pain patients prefer marijuana over opiates. 81%. It's like, they're not stupid. They're like, yeah, it's not going to make me strung out and addicted, basically. I don't know. Over and over, they want to shove pills down your throat when natural remedies probably are better. And maybe there's something to be said about how CBD and THC actually help. You could actually possibly work on what's causing the pain with those cannabinoids, rather than just, opiates are just throwing a buffer on the pain until it goes away, until the buffer goes away. Then you need more, if it even works at that point. So individuals that were choosing to use cannabis instead of opiates to treat pain were doing so because they were having these much better experiences, according to Ryman. And over you hear people say in testimonials, if you've ever paid attention to them on, even on the Sanjay Gupta shows or other shows where they profile medical marijuana and they talk to actual patients. A lot of the patients that are suffering from debilitating chronic pain, one of the refrains I'm always hearing from them is, I can function normally, instead of being basically like stuck in a cloud all day on opiates, or whatever, just fighting the addiction and the withdrawal from the opiates. So that's there you have it, just another study. Here's the actual study, and I'll put a link to this in the description below. Just another study. I do stories about these all the time, and I don't, like the people that are the prohibitionists, they're always talking about studies too, but those studies were definitely stacked. You could say that this study is stacked, but whatever the case is this is real shit. Say what you will about it. These are real numbers. These are real people that didn't die. These are real people that didn't even start doing opiates in the first place. So there you go. Thanks to the Rand Corporation, and thank you to the National Institute on Drug Abuse for funding that study. Who knows if somebody at NIDA was looking to find out, some negative things? Because let's face it, NIDA is behind a lot of the studies that found negative things over the last few decades. So that's what it is, man. All right, have a good one, everyone.